especially when it comes to end of life. It's been unbelievably challenging.
Well, the need for spiritual first responders in Springfield is growing.
Cox Health here in Springfield launched a program so that more chaplains could offer comfort to a COVID-19 patient's family. Keller Sense David Chazanov is here to explain. David?
Well, guys, the program includes clinical and educational training, and residents could become professional chaplains after graduation. Kurt McLaughlin is the System Director of Pastoral Care at Cox Health.
There's a big shift in how we provide support to patients, families, and of course our staff members.
With many changes comes a growing need for more chaplains.
Especially once this pandemic has passed, there is going to be another health crisis, and it's the mental health of our community, certainly even of our nation.
Which is one of the reasons for Cox Health's new chaplain residency program.
Could not have come at a better time.
In the one-year program, residents spend 30 hours a week serving patients and their families. 10 hours are also dedicated to learning.
Processing some of the things that they've experienced, like the deaths, the strokes, the traumas, because this is all uncharted territory for them.
He says the program will prepare people to become professional chaplains. Similar programs have led to success stories. Dana Helm.
That's how I came to Mercy, was through the residency program and the clinical pastoral education.
Helm says people need spiritual support in a time like this.
There's no formula for just the pandemic and the change, and we all have a spiritual and emotional side to us.
One moment that affected her was last week.
Family was outside the room and the door is glass, so they were able to see the patient at end of life. The nurses were geared up and they were in the room and they had their phone, and so they held the phone up to the patient's ear, and the family was able to talk to the patient and say their goodbyes. Heart-wrenching.
And I asked McLaughlin if he has any memorable moments supporting COVID-19 patients and their families. He said it's not an easy thing to talk about and it's heartbreaking.